Assalamu alaikum, everybody. My name is Mustafa Mahmood, and I am one of the leads of IPPA Med. With me on this panel today is Dr. Malik Maqsood Saab, who is also one of the co-leads with me on IPPA Med. And today we are doing this intensive interview preparatory session for IPPA Med candidates. On our panel today, we have got Dr. Shalan Ali, who is a first-year GP trainee. We have got Dr. Kuratulan, who's also a first-year GP trainee, and Dr. Amna, who's a senior GP trainee. Dr. Malik Maqsood Saab has been on a variety of interviews, many interviews. So we'll go through the trainees first. They're going to go through their experience of preparing for interviews. And then at the end, myself and Maqsood Saab will just tell you what are do's and don'ts of interviews. Just for all the participants, this meeting is being recorded. Also, that if you have any questions, better off typing in the chat box. We can open the mic at the end as well. But if you have any questions ongoing that you want them answered, your best thing is that you type it in the chat box, and we will try and answer them as much to our capacity as we can. If there's no further questions, so we'll formally start it now. Arsalan, you have been very recently through yourself and Karata, and both of you have been through the last pilot interview project. So just tell me that when you were preparing for this interview, what was going through your head, and how did you prepare, and how did you find this interview process all in all? Because it would have been something very new at that time.
Yeah. When I start, what I prepared for the interview was that I used to spend time after the hospital with my fellow colleagues in the hospital who were appearing for the interview as well, and we used to go through the common questions. The common questions the usually interviewer always asked. So for our time, we always had a kind of a pilot program where we asked the situational judgmental questions, and it wasn't marked. But it's good this time that it was marked, and you guys have prepared for the situational judgmental questions as well, which are usually the base of interview for the GP scheme. So we used to get a sessions of 1 or 2 hours after the hospital. We used to ask each person specific questions, and you learn from each other. You can learn non-verbal communication skills. What the interview, you would know, I can just summarize it. It consists, so you enter into the interview sessions. You will be welcomed by a administrator who will check your ID, who will go through your surroundings, is everything is clear, and then he will introduce you to the panel. So the panel would consist of 3 persons. The one would usually ask the question, and there would be 2 other persons who would be marking your questions. So the person who would be asking the questions will not be marking the questions at all. And their video would be on, and as soon as the interview starts, their video will be off. Generally, the first 4 questions are based on common questions and communication skills. I would emphasize just they last year they emphasized much more on the communication skills. So try to get all these skills. And I'll ask Dr. Kuratalan if she wants to add something else.
Thank you, Dr. Arslan. Thank you, IPPA, for this opportunity. So just a few more things. As Dr. Arslan said, yeah, they're going to be asking you first few sets of identification stuff, and then after that you will be you'll be broken down into one room where there will be 3 examiners. The 2 examiners will be marking. You can't see them, but the facilitator, you're able to see them. You can ask them questions. So the very first question they ask is the code breaker question, or the icebreaker question. And in my experience, I felt that that was the time that was determined whether you'll be going forward or not. I'm not sure, because in our time, when Dr. Arsalan and I gave, we were not provided with our ranking. Previous years, they didn't mention how our ranking was and where did we stand in terms of the interview. But from last year onwards, they would not provide us with a rank. So the first icebreaker question is the question where we all I honestly felt like we were judged. Are we ready to become a GP or not? And I feel that's the most important question. And that's as one of the interview experienced people told me, like Joe Irwin's interview, and was, that's the only opportunity you're going to get to sell yourself. So during my preparation, 1/3 of the time, what I did was I prepared how I'm going to highlight that I am suitable to become a GP. So I tried to highlight as many things as possible where I was good at, and tried to hide. Now, not many people know, I was the year I gave my interview, I was at home, I was doing my MD. So I had not worked in the hospital setting for the last 2 years, and I have a surgical background. So it was a major thing for me. So over there, so I had to highlight what was the best at that time. So my strengths, I felt, were research, my ongoing MD. So the questions that I was asked was around how I spent my day. I was hoping they're not going to ask me on my CV. My CV was backed up with a lot of teaching and research and surgical experience and everything, but they asked me how my day goes. So many people that I asked last year who feared the exams, they did mention that, oh, they just asked me how my day was, and I said it was good. So it's very, very important at that time we can sell ourselves. So I explained how I go meet my patients for my MD, how I'm a mentor for a lot of students. So I think so it's very, very important you take the icebreaker question very seriously, and that's the time when you tell how you're going to be a good GP or how you're going to be a good trainer in the future. And as Dr. Arsalan said, we have 3 or 4 questions after that. So usually there is no pattern to it, and everybody on the same day has the same question asked throughout all schemes, and everybody has the same question. So in that, usually there is a medical question. There are 4 questions. They're not strictly timed, but they do push you forward, because the interview is set in half an hour, 15 minutes. So in that time, they have to try to get as many answers as possible. So there are 4 questions. In that, first will be a medical question. Then there might be a GP associated question and a psychiatry based question, and followed by medical or medical legal questions. So in that time, so the medical question is going to be very, very simple. And it's in our time, it was mostly a common symptom was asked. It could be like, okay, a 50-year-old lady came with abdominal pain, or a 65-year-old came with a 5 days history of a headache. So just for people who are appearing in the interview, it's very important that you rule out the emergencies. Because many people, again, when I was speaking to people who could not get through, they start with the common causes. But what they are looking for in the interview is that, are you able to find out that there's an emergency and they need to go to the hospital? That's the key. And just one humble advice is like, always be prepared with a line or how you're going to start. For instance, like if we have headache, so I had they're always going to ask you a common symptom. They're never going to ask you something like a Tourette syndrome. So what I had prepared was like, oh, headache is one of the most common presentation that comes to the hospital and to the GP setting, and we have to be alerted. My major priority, or my priority, would be to rule out any emergency. So that's how I started anything. If they had asked me abdominal pain, I would have said, oh, abdominal is one of the most common. So always, whatever suits you, prepare a line so that you are prepared for that medical question. You seem that you are ready. If they ask you, okay, my priority would be, look at those 5 or 6 emergencies. Headache, you should never go without a stroke. Subarachnoid, or those abdominal pain, never go without a AAA. Back pain, cauda equina, anything. So just go through the main common symptoms and see what are their emergencies and go through those. So that's one thing that I felt in my experience. That's how I prepared. So these are the common ones, and this is what are the emergencies for it. Second thing, they're going to ask you how they want you to answer the questions for any symptom is that in a GP setting, when somebody comes in and they're coming recurrently, they want you to explore, is there any other reason for coming in? So every time when we are dealing with any patient, it should be through a biopsychosocial model. So bio means is there any biological cause? Somebody's coming with a headache. Are they getting sinusitis, or are they getting migraines and they're coming and they want you to be treated? Or there are psychological issues. Is there any abuse at home, any issues at home that they're not able to deal with? And social issues, like are they stressed, are they worried? Because a lot of patients that come into GPs are they come with hidden symptoms. They want something else to be done. So usually so they expect you. And I remember I had kept it in my mind that any medical question, I'm going to say, I'm going to explore the biopsychosocial model. And then I went through all that. Okay, I'm going to ask, do you get sudden severe headaches after ruling out the emergencies? That do you get it gradually or so? That's one thing that we have to be prepared for the question. Second, you should have a model or a pattern in your head that you should be doing it. And so is for the other questions, like legal questions as well. Like if the important thing, what I felt during last year, the issue of Mental Health Act, that was started from last year. So Mental Health Act, you should know about the Wonka tree, that the GPs, what are the possible things that they have to deal with. So in the context of that, you have to give your answers. So I felt that while preparing for it, I was going through all of those. Dr. Amna, would you like to add something, please?
Yeah, I think you summarized. I'll just a little bit talk about the interview process and the application process as well. So GP training induction is divided into two processes. One is you apply, you put references, you give preferences, and then you appear for interview. Unlike other training schemes, the application process and interview itself is not as interlinked as we would like it think it to be. So application is just there for a candidate to earn an opportunity to sit in the interview, because this interview, like any other training scheme, is a high stakes interview. So you sell yourself on paper during the application process. Now, when you actually appear in the interview, they don't have your references there. They don't have your CV there. So they don't know that what capacity you work. Okay. So you start your interview by saying your name out loud. Hi, thank you for having me. Dr. Amna Ghaznain is my name. So you say, because it's there, but just to out loud say out your name. And this will imprint when you say it, and it's just on the paper. So that's how you start. So as Kurutulan said, that in the icebreaker questions, so they don't know you already. This is the question they are asking about, to know that what you can bring in the GP scheme. Why would they give you a GP scheme? So yes, that is that opportunity to sell yourself as a GP. So that is the time throughout the interview process itself, so have a posture that reflects enthusiasm. That's the first part. And it's hard on Zoom to give the right image of your body language over the screen, because in actual interviews, when you go in person, you're an actual person, but here you are just someone sitting across the screen. So you need to have a posture that just reflects your enthusiasm. And how your day goes about is they're asking what's in it for us, that what do you have in your CV, in your life, in your personality as a person, to bring or to add something in the. So yeah, that's your opportunity to sell yourself. And icebreaker question is very important question, because the examiner that are hiding behind the screen and marking you, they made your first impression from that icebreaker questions. So that's the question when you can pull out, just like balloons, of what specialty you have done, what special experience you have done. For example, I said that because I have done membership exams, so I will bring a great a clinical acumen to the common presentations in the community. I have been involved in the teaching, so I would like to be involved in teaching and training. And I said that I was at home raising my children, and I was involved in many community projects with my children. So so career break also gave them to see who I am, and despite the responsibilities I had, I was able to come back. So that show commitment. So you can present whatever special about you, unique about you, as your strength. There are things which would be translated as as our shortcomings, but you can actually present it in icebreaker question as your strength, and they are your strength. That there are things that are unique about you, and you are there sitting in the interview, and that is your motivation there. That is the one thing about the interview. So the very first, from the very first questions, you should be able to sell yourself, because many people, and that's their impression in the GP land as well, that the most people apply for 2-3 schemes, and that is just their default application. So you have to show them that no, this is actually your dream, and that is how you want to earn your bread and butter for your life, and you're so motivated to work in the community, because it definitely brings so much to them, to just see that is exactly you're bringing these strengths, you bringing this commitment to this profession. And they will yes, and the communication type of questions are very important, because somehow they think that people who are from other communities might not be able to understand the problems in the community, and would have some problem in the communication skills. So yes, you will be judged on the communication skills. So communication skills is an area that needs to be worked while you are preparing for your interview. Is that right to say?
That's really good. So let's say all three of you, Kurat, Arsalan, Amna, if I am going for GP interview day after tomorrow, right?
Yeah.
And I've got these 24 hours to revise, study, what should I do?
Okay. So I jotted down few things to just what you need to, because the question scenarios, as Kuratulan and Arslan both said, they would be simple. There wouldn't be any rocket science that would be asked. The scenario would be so simple, but you kind of need to see, and that is very important for two specialties, GP as well as emergency department, that the patient that is coming, agenda setting, what is person saying or a patient saying or asking the question, and is there any more agenda to it? So agenda setting is very important. So you need to focus on the questions. So the question will be there for 1 to 2 minutes on the screen. Please give that time to yourself and make the structure. So
You say that the question, so I'm just going to cut you there. When you say it will be there on the screen, will this be typed on the screen just so that our participants
the question
know?
appear on the screen.
The question will be typed and appear in a typograph on the screen.
Yes.
Right?
Yes.
Okay.
Yeah.
Perfect.
And nobody should
And
start
they
answering.
also ask you, do you want us to read it, or would you like us to keep quiet and you read it for that 1 to 2 minutes? So they will ask, how are you comfortable?
Okay, and you've got those 2 minutes before you answer, or you can answer immediately.
You can answer immediately, but I would advise against it.
Okay, no, just so that people there who are on the other side of the screens have an idea what's coming there. And so you said that there'll be a question about GP world as well, right? What is GP? So I'm an emergency physician, and I've worked all my life in emergency department. If I decide that I'm going to go into GP world and I have absolutely no clue about what's happening in IPGP world, Irish GP world, what's my resource? Is there a book?
ICGP has all the current issues. They have all the ongoing problems that are faced. This is exactly how I found out that there's going to be an extensive shortage in the next 5 years. How they have this new system introduced called the chronic disease management. So it's very, very important that people are aware, because one question will be about the GP world. It will be, like, for instance, it could be what are the advantages and disadvantages of being a rural GP or being a GP, or what are the hindrances of being a GP? For instance, they don't have investigations right then and there. So you should be aware. And as Amna rightly said, that you should tell them that I'm going to be the best person for this. So for instance, when they asked me, okay, what is about, I went on and on how I like to work in a rural setting, knowing that around 2/3 of the GPs in the rural setting will be retiring in the next 5 years. So I said, oh, I love working in the rural settings. You have a one-to-one interaction with your patient, you know their families, and so I made it sound like, okay, I'm needed there. So going
Okay.
to ICGP would help significantly.
Okay, Arsalan, tell me one thing in your interview. Arsalan, you're on mute. If you could unmute yourself. Tell me about one thing in your interview that you were a bit shaky about when they asked you. I'm sure everyone gets one question that makes you a little bit shaky and nervous. So what was that one question that was,
So basically, I don't know, Dr. Amna would have these type of questions, but I think Dr. Kulatan and we faced a couple of these type of questions. Like we were given a scenario in the hospital setting. If you're a medical SHO or you're in any department, and you're having issues with your colleague, and what type of communication skills would you use, or what type of communication skills will you use with the relatives whose grandparents are severely sick? So I answered these questions, to be honest, very informally, and how would I do I would do in the setting. So I just said that I'll take my self to the side. I'll think what they're gonna ask from me, and for the patient, for the relatives, I would use the communication skills involving good respect, good rapport, good empathy. I'll show empathy, and I would have a couple of questions in my mind. They would be asking that what we are doing with their relatives. And for instance, with colleagues, they ask what type of communication skills would you use. So I just this was very challenging for me. So I just said I would be very professionalism, so I don't break the professionalism and don't try to counteract with them, and I mean try to make
so
the
it
issue
was more
resolved with
based on conflict resolution.
conflict resolution.
That
Yeah,
was the gist of it, that you could be having a conflict with an emergency department or a hospitalist or a
yeah,
relative or someone, and how are you going to resolve that conflict? So there's a
exactly.
question around, and I suppose that would be the communication skills question most of the time. That would be based around a conflict where you're expected to resolve it.
I think
So
so. We
Yeah,
used to do the SPIES mnemonic for the conflict, like seek info, patient safety. Are the patients safe? Did anybody get harmed in that? But I remember we did that, and for breaking bad news, there is a very good book called the Medical Interviews, Preparing for a Medical Interview. It's a UK-based book, so it doesn't have all the Irish stuff, but they used to have spikes for breaking the bad news and spies for if there's a conflict resolution for this. So I remember
okay,
when I went through that, I went through, okay, I'll seek all
Malik
the
Saab,
yeah.
Malik Saab, have
Yeah,
you?
thank. I think what I was going to say is the information we have gathered so far is excellent, especially from the people who have been there and done that. And what I would like to add is that it's extremely important to prepare yourself, as it is said that fail to prepare, prepare to fail. So first of all, which I have learned after coming in this country, is that you need to take an interview like an exam. You cannot just think a day before that, okay, tomorrow is my interview and I'm going to go. Just think about the exams that you have done in the past, how much preparation and effort you had to put into those. Similarly, as Kuratulhan has said, you need to prepare your answers. The questions are structured and the answers are structured. The answers are given to the people who are marking you, and they are standardized, and they are taken from the national guideline. For example, if you talk about communication skill or conflict of interest, all of that guidance comes from the medical council. So there is a small booklet which is available to everyone, and we have to follow that when we are dealing with these situations. And another important thing I would like to say is that it's a very, very acceptable answer in many situations that I would involve my senior colleague be a registrar or a senior GP trainer or whoever, because we are not, none of us is expected to do everything on our own. So they want to see that you are a team player, you are able to involve other people when you are in a situation where you are a little bit unsure or uncertain. And I think it's very important to understand that this is a very structured process, and just like an exam, it has questions and it has specific answers. They would be looking for the buzzwords, as for example Arslan used the empathy. So these buzzwords have to come out of you, and they will give you some hints as well to try to get those words from you. So it's very important that we follow that. But I think preparation, and
Yeah.
practice beforehand. It's not something you are taking very casually and informally and going in. It's like an exam. It's like a test. It's something you will have to act like. But I always try to tell our trainees that if they are used to following a certain process when they are seeing patients in the normal situations, they would not need any additional preparation. For example, we are in ED, our SHOs are in ED dealing with headache, chest pain, all those things. And those questions, for example, you have chest pain, there are 4 or 5 life-threatening conditions. You always have to exclude them, and they can be excluded almost certainly with the story, by the story, and the GP can decide whether they need to send the patient to. So I think this journey actually starts much earlier than we think. It's not that we plan today. As a doctor, what we do, we should try to do it at the best level possible. And if we do that, this is what the interviewers are looking for, that you are a competent and safe person and a reliable person, a good colleague whom they can get along well. I mean, one of the questions we ask ourselves when we interview somebody, that will I be happy to work with this person if he or she was my SHO or my registrar? And the characteristics you need are, of course, the competence and the skill, but also their collegiality, how they have behaved in different situations. Like Amna told us, and Koratolan said that she was in surgical and she's doing MD. It's not what they are doing, it's how they are dealing with those situations, which is important as well. You might be in a hospital for 5 years and you have not done any research, and you are surrounded by people who are doing research. That tells us about you that you are not interested. On the other hand, you are a mother and you are looking after your children, but you are also engaged in research and you are mentoring and you are teaching, and then this tells us that you are multitasking. So these are the things which 3 of our speakers have told us as well, that we have to sell ourselves. We have to, they won't know what you are able to do. So I think the most important lesson that we should all learn is prepare, and prepare early, and prepare your answers, and go there with a prepared answer for these questions. There are not many questions, there is a short pool. So I think preparation is the key. I have seen people who come in for the interviews and they're very casual, they're random, and we lose interest as well. Look, this person is not serious, they have not given any thought or any effort for this whole process, so why should they be hired? So I think the information which is given by all of these 3 people is extremely important, and people who are listening and who are planning this year or even next year, they should actually, the people who are planning next year would benefit more, because they will be able to start preparation from now onwards. That's what I would like to say, Mr. Thank you.
Thank you, Malik Saab. So, guys, before I open the session to the house, Amna, 3 things. If I'm going for interview tomorrow, what would you like me to do today?
Yes. So if Dr. Mustafa is appearing in the interview tomorrow, what I would say to him, I would say him, go on icgp.ie, read in and out that website, go on HSC, find out what's there for GP. You write the GP and things will come out. You will go, the GP trainee that is working with in your team, you will ask, do you have your GP forum journal of the recent issue? Do you have that? Can you lend me for tonight? And you will get that, and you will skim through what are the recent issues that GPs are forming. You'll go your local newspaper, you will say, is there anything about health? Is there anything about GPs? What are the issues? What is specific about my city? Does my city have prison? Would that cohort will be coming to the scheme I'm applying? So I would advise you to go, and I would advise you to go Irish Medical Council website and see what are the medical ethics and complaint process.
Okay, perfect. So what you want me to do today is to go through ICGP, to Google GP problems in Ireland and try and read as much as I can. And if I can get my hands on a GP journal from one of my fellow trainees and read through, and that would give me enough idea. Kurat,
This,
if I
it
ask
would
you
look
three
like
things,
this.
it's like look like. Thank you very much. And will there be a copy of this online somewhere as well if I want to download?
Yeah, there would definitely be.
There
I
would.
never checked it on online. Before I was going for interview, I borrowed it from my friend who was
Perfect.
on
So there
GP.
might be a copy online, or it might be that there's a paper thing only. Kurat, three things that you would recommend me today.
I would say like one, relax. You have already prepared. If anybody who has passed the AKT or SJT, that means you are medically sound. You're doing well. One, relax and calm. Nerves is everything in the interview. And second thing, as Amna said, go through the current issues. And third, as Dr. Saab said, Dr. Anwar, he said, be prepared. You should have practiced. One thing what I did on the last day was I sat and I recorded myself to see where I am. Because one thing what we do is, I'm not sure how I am now, but our camera is usually above or below level. So I started recording each and every of my answer. Differential diagnosis of headache, stomach, what will I say? And so I recorded and saw if I'm at the eye level with the judges or examiners. So just these three things.
Salan,
Yeah,
any
so
final tips?
I think everyone has covered already. Yeah, same thing. Just for the common questions, everyone asks, why do you want to be a GP? Just make a format of these, write it down, and practice as much as you can. This is the icebreaker question, simple question, challenges, all these. There are a couple of 10 or 15 questions. Write them out, practice them as much as possible. That's all.
So we know the most of the questions already. They'll be around why do you want to be a GP? There'll be an icebreaker question, which would be a generic general question. There would be a simple clinical question, I suppose, could be a chest pain, headache, common presentations. And then there would be a conflict resolution scenario. So we know those questions already. We need, in our heads, we need to have a mental format of that. If this question is asked, this is how I'm going to approach them. Maksud Saab, I'm going to come back to you. So you have been on the interview panel lots of times. Tell me 5 things that I should not be doing in an interview. Maksud Saab, you're on mute. Malik Saab,
Yeah, I'm on now. So as I said, I think the interview does not just mean the time that you're going to spend that 30 minutes or 20 minutes with those people over there. The preparation and do's and don'ts starts way before this whole process. So first of all, I would say that you need to plan it ahead of time. You need to talk to people like we have today who have done this and be as familiar to the process as possible so that when you go into the process, you're not surprised. And it's not, in my experience, personal experience, when I was interviewed and when I've seen other people being interviewed, you should not be, if I go unprepared and you think that you are clever enough to formulate an answer while you are sitting there, then you're totally wrong. You need to know beforehand, as Koratulana said, and actually she did that practice. And I went to a organization who prepares for people for interview, and they had a video. They videoed me and they provided it to me, and we did it. And then the person sat with me and went through my recording, and we discussed each and everything. And this is something she did herself. It's very good. I think one of the excellent ways of seeing what you actually look like from the other end by recording it. And it's very easy now. You have your handheld cameras, your phones, and everything. So, and the second thing is that you need to know what you're going for. The preparation is different for different interviews. As we were talking earlier on, BST is very different, as I have learned today from your information that GP interviews are different. So you need to have yourself organized according to the need that you're going for. So similarly, your CV, your interview should reflect what you're going to go for. And as Amna said, that you have to tell them that, look, this is something which is my dream and I'm going to go for it. The other thing, a very important thing, is that you really need to make sure your IT is working. As Kuratullah has alluded to, we have seen that sometimes, the IT, there's a problem. There are ways around it as well, but you should be prepared for it. it's better for you that on the day there are no such hitch. And lastly, what I would like to say is that you need to be very confident. You have to have eye contact. Just consider it as a real time interview, even if it is online. And the way you speak, the way you present yourself, it really matters a lot. And as all of the candidates have said, that the first question, the icebreaker question, is something where they actually you see what you are and what they are going to get out of you is extremely important. So I think in nutshell, it's preparation, and it's preparation from the beginning and way before the actual interview, and talking to people who have done this already and knowing the process as much as you can, so that when you go there, there are no surprises for you. The questions they ask are very standardized and you have answers for them already. And that is the best way you can give yourself the best chance to be successful.
Perfect. So just to summarize everything, so if I divide it into boxes, now most of you have got interviews day after tomorrow or day after tomorrow. So you have done the reading part. You've gone through all the things. I hope. I hope. If you haven't, then there is a problem. But I'm assuming that you have done the reading part. What I would focus today is I would focus, if I divide it before the interview, I would find a nice quiet room with good lights. If not, I'll probably get a light in front of me. I would check my microphone. I will have a standby microphone. I would check my internet router. I would like to make sure that I've got good Wi-Fi here, that there is no vocal interruptions, because as an interviewer, something that annoys me the most is if I can't hear you because of your Wi-Fi or microphone problems. So I would check that. I would look at myself, record myself, and learn some Zoom etiquettes, because what happens sometimes is that we're not used to looking at a screen and a camera, and the camera might be in the right corner and you might be looking at the left corner. So it looks like when I'm talking to you rather than talking to you, it looks like I'm talking to the sky. And it's a very common phenomenon when we do interviews over Zoom, particularly. Then people don't know this, they don't realize as much that the webcam is there. If you're looking down at the keyboard or you're looking down up at another bigger monitor on your left hand side, it looks like that you're not looking at me and you're not making eye contact. So that is an important thing. Using headphones rather than can you ask the question again? Can you ask the question again? I suppose that would be, unless you've got very good laptops and headphones and everything, I would strongly recommend using headphones. Get into a quiet area where if you've got children or kids or someone else, ideally, get someone to mind them for that, because it's 30 minutes only, that there are no interruptions, and have a backup. Do not use your phone for a video interview, because phone is fiddly. It is going to fall down. It is going to go off here and there. So use a laptop. So that is before the interview. During the interview, my examiners don't know me. I don't know them. It's a blank screen. Icebreaker question, medical skills, which is more about what I'm getting back from you, is about triaging the emergency. That is, this patient who's coming to me, does he need to go to the hospital? What is my worst case scenario? So rather than working from common scenario up, you start working from worst case scenario and you walk yourself down. Then there will be a question about communication skills, in which, it'll be more about empathy, breaking bad news, feeling about the patient, and there are various techniques that Karat mentioned there. And then there would be something about being a GP, and the information is on ICGP website. Uh, I suppose, and again, be presentable would be another thing. Don't dress up very casually. If it is, go there as it's an actual interview, because have a tie, have a coat, have a shirt, or dress up appropriately. As if you're going to go for a walk-in interview there as well. So I think that summarizes everything. Have I missed anything from this session?
No,
I think sorry,
one
Amna, go ahead.
point I was sorry, you go ahead.
No, it's okay.
No, I think you gave all the points. That is very important to think about the Zoom etiquettes, as well as Dr. Maksud said, the buzzwords are very important to incorporate. Now, for GP interview, there is a picture where you can get all the buzzwords, and that is on ICGP website. And if you find out core competencies of GP, there you go. That's all your buzzwords: holistic approach, team working, empathy, sympathy, resource management. Those, so I printed that picture and put it in my room and saw it every day before the interview. So that's just, I would like to make a comment that print that picture and
And
see it
make sure
every
you
time.
remove before the interview.
And one thing I was going to add from my experience as being an interviewer as well, it's important for the candidates to understand the gist of the question. So the question are categorized. So for example, if you have read enough and if you have enough experience, you will know from the vignette that this question is asked about capacity. This question is about communication skill. This is a clinical question. So for example, we have a patient, you can't get a patient in the GP surgery who comes to you and you want to send them to the hospital because you think there is something life threatening. The patient refuses. It might be a question of capacity, that do they really understand the nature of the problem and the consequences of not attending the hospital. So it might be something that you have to, so if what I saw in the candidate is that the sooner they identify the gist of the question, they are able to answer. Otherwise, they are talking about right, left, and center and not coming to the actual thing which needs to be discussed. So I think your knowledge, your experience, and your reading, that will tell you that when a question is asked, what exactly is actually they're looking for. And that is where, as Amna said, the buzzwords will come as well. You can start by saying, here, my issue is that I have to decide about patient's capacity. This is how I do it. So it's not a question about the causes of headache at that time, for example, or chest pain. You have decided about that, but now the next step is the patient is not complying. What do you do in that situation? So it's very important to know from the question, the way it is made, what actually is being looked for. I saw many candidates when we asked them about chest pain and the question is about capacity, they start talking about the differential diagnosis of chest pain, that this is MI or acute coronary syndrome, blah, blah. So we had to again try to give them hints, but still, some people struggle. So this again preparation that will give you that.
Perfect. And one more, just to add on to everything, remember that the interview is about you. Okay, you have done your exams, they know your clinical knowledge. The interview is not about asking you the differences of abdominal pain or something. It is also about you. So connect it with your experience. For example, when I had a patient in my emergency department or as a surgical SHO who had that, and I did this to exclude, life threat. So bring it back to yourself if you can. If you don't make it up, because if you will make it up, I will know on the other side of the screen that you are making it up. Okay, remember that people on the other side of the screen, they've been through number of times and they're very, very, very quick in picking it up. So do not make anything up. However, try and bring it back to yourself that in my working as surgical SHO, I had a patient who was refusing to get operated, and then we had to go through capacity questions through them, and this is how I did, and I involved my consultant, I involved my registrar, and something like, so bring it back to you. So I'm now going to open, so we have summarized everything, and we will uh, open the panel to to our participants, and I would prefer if you could type the questions down. So one of the questions is, will we be allowed to keep a pen and paper to make the points during those 2 minutes?
Ideally, you shouldn't,
You
because
shouldn't.
it will just delay your thought process.
How much time do you give for an icebreaker question?
I think ideally not more than 2 minutes. I mean, I think it's 2 minutes is sufficient to answer the question.
I think the other thing, Mustafa, is that as soon as the interviewers are satisfied that they have made a decision on the basis of your answer, they might even stop you if you're going on and on. That if they think that
Yes.
it's a good answer, or if you are going into the wrong direction, they might even stop you. So I think the important thing, as we discussed earlier, is for you to identify the question and the appropriate answer, and it should not take too long. So if you're talking about inappropriate or irrelevant things, obviously you might be stopped as well, or guided, or whatever they think.
They might guide you back to a more appropriate.
Just wanted to add, the interview would be very kind of friendly. So they would ask you to take time to answer the questions. So ideally take 15 seconds. And whenever you complete the answers, they would ask you if there's anything would you like to add. Generally, if you have something you can add, otherwise you can say, because they're going to keep you asking in each questions if you want to add something else. So yeah, that's all.
And one thing I would like to add is that I must say from my experience that the interviewers are very sympathetic and they are really very generous as much as possible. So of course they have to identify, they have a limited number of seats, so they can't get everyone, but they are very sympathetic and generous. And if you make a genuine mistake, they will give you time to rectify that.
In fact, there's a question about a medical legal question example. Is there any, do they touch medical legal bits?
Yes, they have to, because one of the question will be medical legal. So they will ask you question examples would be like your colleague asks you a request that you feel is not medically legally not right. How would you approach that? So then again, it's not a yes or no question. It's how you are going to approach it. Again, the biopsychosocial model comes to kick in, and looking into the eyes, the ideas there. What are their concerns? Why are they asking you for such a request? So you have to, or there are questions like somebody in your workplace is being inappropriate. How would you deal with that? So again, there are patterns to it, how you're going to deal with it, see what are the reasons why they are behaving in such a manner. And deal with that. I think so. That's the
So
only.
some of the medical legal issues, as you know, Mustafa, are around the resuscitation, for example, that
Yes.
you want to make somebody as not for resuscitation, and the family goes against it. And again, there is clear guidance by the medical council who is in charge of making these decisions. First and foremost, it's the patient who is in charge of what happens to them. And obviously, if the patient does not have the capacity, the physician treating the patient can make a decision based on the best interest of the patient. Obviously, we always like to keep the family on board, but if there are conflicts, we need to know what are the next steps. But I would say for an SHO interview level or for a registrar level, even, you can always say that if it goes to that level, I would involve my seniors. There are people in the hospital who would be able to help you. There's medical legal team, that your consultant is obviously there, your registrar. So you are expected to go to a certain level. You're not expected to be
Because
able to do it yourself on your own. So I think that is something you need to keep in mind. Yeah.
Hamza,
And
do you
if
want to
you're,
add?
sorry, can I just say, and if you're not clear in any question about legal stuff, you can always say that you will email or contact medical ethics part of medical council to get the guidance and support. Also,
Exactly.
there are certain legal matters that is specific to GP. For example, legislation around Mental Health Act, termination of pregnancy, contraception in underage girls, as well as support and treatment of substance abuse. So these are the medical legal aspects one should look into prior to interview.
Exactly. That was what my next question was, that, in the hospital, I can escalate to a senior consultant or to the medical director or someone else, but in GP land, who do you escalate to? Well, if there's a question that this is your senior GP, and so is there a specific, step ladder that you take?
Yeah. So if there are if it is a multi GB practice, you can discuss the issue with your peers, and you can discuss the issue with practice manager who is a business manager part of the things, and you can seek guidance from a medical council's ethics department and
Okay.
support.
It's like good to know, and I hope our participants are taking these notes down, because these are really important things that I didn't know. I've been working in the Irish medical system for long. That what would be, how would you escalate if you are sitting out in the public? Can you please give an example on how would you incorporate your strengths and qualities of being a good GP in an icebreaker question? For example, to answer, how does your day go? Your strength, that you are great in research. If I start talking about my research experience, would it not seem as a bit out of context? Does anyone want to take that question?
I think maybe Kuratul Lam, because she has the real life experience of same scenario.
Well, no, I had prepared at that time. I had written it down, mugged it up, and vomited out over there. But I think so. Essentially, as I said, that I was not working in a hospital setting for the last 2 years, so I was very nervous about that. So I tried to push towards my research, but I made sure that it comes to an advantage. So, for example, they're looking for trainers in GP services now to train the following, because every year there are around 200 to 250 to 200 new the new participants or trainees will be coming in. So I highlighted that I have 3 years experience in teaching by explaining, like they asked me, how does your day go? So I said, one, I'm dealing with my patients. I go interview patients about their food diets and so explaining that I'm in the hospital setting, ensuring that I am aware of the current issues in the hospital. Second thing, by explaining that I'm doing a research, I'm well up to date about any information, any issues there are. One second, not just explain that this is the research I have done, I incorporated it into the necessity for GP-ship. So third thing, they need trainers. So I said, okay, in the afternoon, I am a mentor to various students. So I go and speak to them and ask them how their research is going, allowing them to, understand. And then also I did put in that I have 2 kids and then I manage my home and everything over there. One thing very, very important in GP is work-life balance. So by explaining my day in such a form, I showed that I have a good work-life balance. I am also a good trainer that they will be needing in the future. I have a good experience, not just teaching, research, and in hospital setting. Even though I did not disclose that it was mostly in surgical, but even though it's not like it's illegal or something, but I did not mention that it was mostly in surgical. It was, so I just showed I have good experience, good enough that they're allowing me to teach and mentor other people. And also I have a good work-life balance. So in this form, so look at your strengths and incorporate it, not just research. You might have a good experience when it comes to, you might have gone to various other fields, like you would have done psych, you would have done medical BST or so, and just show. And of course, I had my membership exams as well. So that also I put in that because I remember.
You're basically presenting yourself as a multitasker, which I suppose is extremely important for a GP surgery, because you're looking at the business aspect as well. You're looking at the resource aspect as well. You're trying to manage your time. You have to find your time for your family as well. So I suppose that is what needs to come out, if and that is how does your day go. So that is, I suppose, the gist of the question is that how good are you at this multitasking, that you mind the family, you mind the house, you mind your patients, you look at your research, you do your membership, yet you are this holistic, empathetic person who's looking after the patients as well and imparting training as well. So that is an amazing way to present. Dr. Khalid Sarwar Khan and Professor Mukhtar Saab are here as well. Khalid Sarwar Khan is the president of IPPA. Khalid Saab, have you anything to add on to the ongoing discussion, sir? Dr. Khalid.
Assalamu alaikum, everybody. Sorry, I just busy in something, so I cannot turn on my camera. But I just wrote on that chat box. I think I noticed good few of, including my wife, had a career break, and that is a reason I think you have to prepare to answer sensibly about the career break, and they should be logical. And we all know with the family life, as Mustafa has mentioned, there may be career break, especially in our Pakistani families, females mostly sacrifice, which is not fair, but sometimes this happen. So that's, you have to mention in a proper way that it doesn't show that you're not serious about it, but there was a need for the family and that you did. But you also need to cover it with saying that you were doing something in that break, like for example, some research or something else or some courses. So if you have any, that will be good to put in there. And the second thing, a long time somebody mentioned to me in the CV that there may be some weaknesses in your CV, gaps or your research. Some people might not be able to do good research so far. It doesn't mean they shouldn't go for interview. You should go, and even if you have any research which you have just started, bring it in the discussion. At least they will know that you identify the problem, you now looking to rectify it, and you are working on it. So that is also give you some kind of little marks on it, and then you can talk what you've done and what you are looking into, what you're seeing for the research and things like that. I think most of the things are covered there. Thanks.
Exactly. That is what someone told me, that prepare for the worst question, the best. The thing that one thing that you're really scared of, if they ask me about this, what I'm going to answer, because someone said to me, and in a very high grade interview, in my fellowship interview, I was asked, so your CV is absolutely shocking in research. How do you answer that? And that was an actual question. I'm not making it up. I was like, your CV is brilliant, but when you look at the research aspect of it, it is absolutely shocking. So how do you? But again, the good thing about your interview is that your CV is not there, so they don't know quite a lot of it, which is good, which works good in certain ways. Uh, Professor Mukhtar Saab, sir, are you there online as well? I can see you on Zoom.
Yes. Yes, I am.
Sir, have you any words of wisdom? You've been through lots and lots and lots of interviews from interns to consultants. Any words of wisdom for our candidates?
No, thanks. It's a apology. I joined a little bit late due to pre-commitment. And one of the question, I think somebody put it in the chat box, is Mariam Ali, and she's asking about if she has any extracurricular activity, should we mention? Absolutely, they should mention, because they're not looking for only that you're good at the medical side. They want to see it, what your, extra curricular activity, how you involve in the community, how you communicate, how you take part and supporting other people. And I strongly, there are two aspects. One is about our medical career. A lot of people, they focused only what's written on the CV there. But as when I was going for my consultant interview about 15 years ago, one of my senior colleagues told me, and very rightly advised, that don't mention everything around the medical side. We want to have look a normal human being who lives a normal life, face normal challenges, personal challenges, family challenges, and community challenges. And you have to come along very good answer. That is, you are a normal human being who can deal all those things and progressing very well in the medical field. So that's my advice. Be honest and give them whatever. If there's anything extra you do, charity work, community work, interpersonal relationship, they want to see in those examples.
Thank you, Professor Saab. Have we any more questions? We've got 2 more minutes. We probably can take one more question. Mariam, audit is same like research, and absolutely audit is same like research. Things that you shouldn't know is, don't beef up your CV with things, or your interview with things that you haven't done. And because I will find out on the other side if you tell me that you've done 25 audits, but you don't know much about them. It'll go really, really bad for you. So don't just put something in just to make your CV look a bit better. No, if you don't have something, just say, listen, I don't have this thing on my CV, and I am going to work in next couple of years to improve myself on it. Have we any other questions from our participants? If we don't have any further questions, any final words, Amna, Kurat, Arsalan, Malik Saab?
No, I think I would only like to re-emphasize again that please start preparation early and get as much information as you can. And one of the questions in the chat box was that, do you really need to know about the actual position, even if you are outside? It doesn't matter where you are applying from. We have had candidates from Australia. If you are interested enough about a position, you should be able to get all the information about that, whichever is available. And in this day and age, it's not difficult. It's all online. If you're applying for a GP position, you need to read, as our speakers have alluded to, and this information is available everywhere, wherever you are. So there's no, you can't justify not knowing because you are in another country. The competition is very fair. They're not going to give you any grace or a generosity, showing any generosity because you are in another jurisdiction or country. You need to compete with the people who are here. So very important, prepare yourself, get yourself familiar with the process, practice, and as Koratulanan has done, make your videos and see them, and that is how you will identify your mistakes and you can rectify them properly.
I will also
Introduce.
answer this question. The ICGP prospectus have information about all the particular schemes. So it's all there. And links, if those particular schemes have their own websites and their separate prospectus, so go on ICGP website, it's all there.
Perfect. Mohammad Isa, introduce yourself. Should we start from your graduation internship to current? Yes, that's how you should. But remember that those 2 minutes is your highlight to show how wonderful you are. So don't waste it. Okay. Don't tell them that in class seventh you won the first prize in your, exam, because I'm not really interested. So those 2 minutes, those 1 minute, walk me through your CV or introduce yourself. This is for your opportunity to tell me how wonderful you are. Okay. And that will be the only opportunity that you will get in this 15-20 minutes to tell me how amazing you are. So don't waste on things that don't matter. But yes, have a pattern. You can walk either top side bottom or bottom side up, depending upon where your more achievements are. If your more achievements are in the last 3 years, rather than when you were in first year med school. So I would start with my last post was this, and in that post I did this, etc., etc., etc. So structure it around it. I think we have covered. We will be guide for scheme locations as well. Yes, we will eventually, inshallah, when you'll all be successful. We have got a huge panel of GP trainees now who can tell you what schemes and which schemes are better, what are the pros and cons, and etc., etc. Hopefully, inshallah, when you'll all succeed. I think we'll call it a day. We are 2 minutes over time. If we have no further questions and no further golden words from our panel, I would especially thank all our panel, Kurtulan, Arsalan, Amna. Thank you so much for taking your time out on a Sunday morning, Malik Saab, you as well, because we all have family commitments, and it's amazing that you guys took this time out and help our candidates. Thank you, everyone in the panel as well, and on all the participants coming over. We from IPPA, myself and Maksud Saab, we wish you all the best. If there are any more questions, please ask them on our WhatsApp group. We've got a wonderful panel of lots of different people there. We'll try to help you through as much as we can. Thank you once again. Allah Hafiz and all the best.
Thank you.